lives. And no one has apparently joined, so we'll just wait for a while. I'll just give it 2 minutes and then
that'll be fine.
count could stay till 5. Good. Okay, I think we can start, sir.
Yeah.
Good evening, everyone. Thank you for joining us today on this Instagram Live. I'm Gayatri Devi, counseling psychologist from Hamsa Rehab, here with Dr. Binesh Balakrishnan, PMR from Hamsa Rehab. So today we thought of going on this live to bring an awareness towards men's mental health, as June is the Men's Mental Health Awareness Month. And the topic of our live is the silent weight, because that is exactly what it is. Men, they are told to carry this weight because of their expectations and the society, to hold everything within themselves and to not reach out to anyone. So addressing all of this is the goal of our life today, with an added lens of cultural context, mostly Indian and South Indian context. So before going into the discussion, I would like to start off with some statistics, some really hard truths. Studies show that for every woman, 2.5 times the higher the men are at risk of suicide, and suicide is the commonest cause for death in men aged 15 to 39. And in spite of these high numbers, only a few are seeking out active help. And even in urban cities, urban population, only 40% of the men reach out to health telelines and discuss their concerns about their psychological distress. And they are the exceptions, not the norm. And I would say that the mental health gap is nearly 85% in our country right now.
Gayatri, what is the mental health gap that you're talking about? Elaborate on that.
Okay, so mental health gap is that people go for physical treatments because they give that importance and they are aware of their physical health concerns. But when it comes to mental health, they don't prioritize it because of their lack of knowledge or awareness towards it. So 85% gap is that nearly less than 15% of the total population seeks out active mental health help for their distresses.
In this regard, I had conducted a survey using a Google form. Out of the 153 respondents, 71% of them claim that mental health issues are not addressed adequately in our system.
Yes, sir. True, because like we discussed, that's mostly tied to the way that our culture and society views men and their mental health concerns. Ever since a young age, our society tells men or tells boy childs who cries don't cry like a girl, don't cry like a child, and they are so conditioned to hold everything in, to not express their emotions, to suppress all of their emotions.
But isn't resilience building something that psychologists usually resort to?
Yes, we do have resilience building as part of our psychotherapeutic interventions. But resilience is an healthier skill where like people learn to acknowledge and process their emotions by learning to adapt to any adversities and overcome any challenges. Whereas in emotional suppression, the individuals they deny their own emotions and feelings because they're scared to face that or they don't have the resources to face that. So that becomes so we live in a society where emotional suppression becomes sort of like a discipline that shows like how strong they are and how skillful they are. Emotional suppression becomes a skill here, and vulnerability is equated with weakness. And
So you're saying the society is stigmatizing emotional expression in men, and because of this, the mental health access by men is not optimal in our society.
exactly, yes, because even people who are educated and they are very scared and hold back themselves from reaching out to mental health professionals because they are scared what the society will think, what their family members or what their immediate environment will think about them reaching out for mental health help. So in that way, I would say that societal stigma is highly there.
Okay.
So moving on, like we can also discuss how media plays a role in this in these limitations with men's mental health. It's that we live in a culture where media portrays our heroes, movies, serials, or Instagram, social media, everything. They portray heroes or the male characters as someone who's very strong, very independent, very action oriented, problem oriented, and everything. Who's always does everything by themselves without getting any help. And anytime a character expresses any emotions, it almost becomes a laughing stock, becomes a meme, a viral meme, a template, and that's all we equate emotions to. And that teaches our younger generation that if you don't suppress your emotions, if you don't hold it all within yourself, then you're nothing.
I remember when Will Smith was crying about his wife's issues and he started crying on screen, everybody made a meme out of it. So what you're saying is media is slowly priming its viewers with the wrong stereotypes of men. Men who don't cry, men who don't express their weaknesses or their insecurities or their mental health concerns, right?
Yes, I would say that because like we have this term in psychology called aggression priming, in which says that the content that we watch, not just what sort of content, but the number of times we watch it and how consistent we are watching it, they have an effect in our brain, in our neural system, which like when we see all these movies and all this media content that glorifies and celebrates violence, gradually their brain, it starts conditioning and it starts equating violence and aggression towards any conflict or any problem. We can see it in road rages, domestic violence, and or intimate partner violence, a lot of these other things, that any mild inconvenience happens, the being aggressive is some people's first line of response.
TV violence and movie violence and legal issues is something that the legal system has been grappling with for decades. Of late, movies and TV series are portraying criminals and psychopaths and serial killers as heroes. What happens is this promotes abnormal behavior, psychopathic, narcissistic or Machiavellianism as normal, and it even glorifies it beyond normal. And in a system like ours where legal system is corrupt and sometimes justice is not delivered, these kind of repeated exposures on TV or media of other sort can promote abnormal behavior patterns, right, Gayatri?
Yes, sir, it does do that because like the reason why people started going into more of this dark crime thrillers and dark crime stories is that it sort of becomes an escapism for them. They sort of get addicted to it, like similar to internet addiction and pornography. It's rather more than the engagement, it's that they are trying to run away or escape from their real life distresses, and they engage in all sort of these sort of media content, and they start consuming it, and it sort of like becomes a respite for them. They start finding the relief in that, and this instant gratification of it keeps on becomes this loop where they start getting addicted into it. But what happens is that they don't realize the consequences of that, which prolongs their isolation and further leading to depression or social anxiety and poor interpersonal relationships. But they don't have an idea or understanding of all these consequences. Rather, they're stuck on that immediate gratification, that instant dopamine hit is what they're after because of this addiction.
So digital dopamine is highly damaging is what you're getting at, right, guys?
Yes, sir. Because like there's a significant difference between delayed gratification, where you get all this dopamine and serotonin after an effortful task, and though their effects tend to stay for a longer times and are considered generally healthy. And then we have this instant dopamine, where more than the result, it's the means that becomes affected here. That instant dopamine and instant gratification is not something that's particularly healthy in a longer run. So on this vein itself, we're going to also discuss how men's mental health is affecting rehabilitation.
So in rehabilitation, we can discuss the psychological issues as primary psychological issues like mood disorders, anxiety, anosognosia, dysexecutive behavioral abnormalities, emotional lability, and aggression. We also have secondary psychological issues like sleep disturbance, sexual disturbance, pain, poor perception of their own condition, and breakdown in societal or family relationships. Now, many of the conditions have been clearly outlined. For example, depression is clearly associated with spinal cord injury, traumatic brain injury, multiple sclerosis, amputation, stroke. It has also been documented that young paraplegics are highly prone to commit suicide. But what you have to remember is whether it's associated with a condition or without a condition. If you have a psychological issue, you have multiple options today. Whether it's medications, there are tons of medications with very few side effects, which have a very good drug profile. We also have newer treatment options like transcranial magnetic stimulation for depression, which again is very, very useful. Even when it comes to psychotherapeutic measures, Gayatri, as you know, there must be a huge list of options you have for each condition. Another thing worth remembering is that if at all you are diagnosed with a psychological or psychiatric condition, you don't have to forfeit your freedom. It is not like you have to spend the rest of your life inside a room or something. You can be free, you can take the treatment options, you can become better, and you can improve the quality of your life.
Exactly, sir. So, just like Sir said, psychology and psychiatry or mental health in general plays a huge role when it comes to rehabilitation or recovery from a chronic illness or any neurological conditions or any disabilities. But the thing is, our society or our culture or our generation of people don't have the enough awareness of how important emotional health here plays a role. But because they equate recovery and well-being with only in a physical aspect, like as long as they're able to lift up, move their hands and move their limbs, then that's all that matters. But no, recovery or rehabilitation is further more than that. It's figuring out your own identity and regaining your autonomy and regaining your sense of self. Because like we discussed in the cultural context, at one point, masculinity or men, their entire identity is being put into this framework of being a provider, being a protector, and being physically strong. And because of a disability or an impairment, they find themselves lacking all of these capabilities. And that puts their entire self-identity into a sort of a crisis. And that is where mental health professional comes into play. They help them figure out their own values, own importance, own sense of self out of this limited framework the society has put on them. And this is why having this holistic approach of biopsychosocial model is very, very important when we see an individual or a patient for rehabilitation purposes. And yes, on this vein, what we as people can do is that we have to redefine the concept of strength. We have to redefine this concept of masculinity, which again is already happening, like little by little, but it's there. We could see it in the little corners of social media or little corners of media, which promotes and encourages men to be more vulnerable. With that, it shows with we have to start telling our younger generation that it's okay to cry, it's okay to show emotions, and there is strength in reaching out. We have to create, we as individuals, all of us carry this responsibility to create this inclusive environment which will be warm and welcoming, a non-judgmental zone where individuals or morally men can open up and share their struggles and everything without any fear of judgment. And that is something we all have to carry. And yes, so we would like to say that it's time that all of us unlearns all the old stories and relearn the new patterns so that we could form a more inclusive society where everyone can be healthy.
Ryan Holiday, the author, once said that life should be considered like a battle. In a battle, one soldier will not hesitate to ask for help from the other soldiers. Similarly, if you have a mental health issue, you should be brave enough to reach out for help. Another thing is, vulnerability is what makes us human. So we have to accept that. More importantly, India is the biggest constitution on the planet. It's the biggest written constitution. And it guarantees equal rights to all its citizens. Unfortunately, India is also a society where stigma for all kinds of diseases is maximum. I believe the society should stop stigmatizing people with all kinds of diseases. That is a huge step for physical as well as mental health improvement in our country. So I think we can accept questions from now.
Yes, thank you everyone for
Thank you.
joining us. If there are any questions, you can post in the comment section and we'll be responding to it accordingly. We'll wait for a few minutes for any questions to come. I think we won't be getting any questions.
We'll wait for 2 minutes and then
Sure, sir. Hi, sir.
that's it. Hi, no question.
I think cannot.
Yeah, we have to
Okay, everyone. I don't think we'll be getting any questions. If there are any questions, we'll be winding up now. So yes, remember to be kind and try to be as non-judgmental as you can be. And if there are any further questions regarding any health concerns or anything, please post it in our Hamsa Rehab comment section or reach out to Hamsa Rehab and we'll be here for you.
Thank you.
Thank you. I'll just close it here.
Yep.
Okay.